Many patients come to plastic surgeons seeking a rhinoplasty, sort of improvement in their nose shape. And just to kind of very briefly go over the basics of rhinoplasty, rhinoplasty really encompasses the whole gamut of operations which are designed to change and alter the nose shape, and with that a little bit of the function, often to kind of improve breathing, improve airflow in the area. Whole volumes have been written on the subject of rhinoplasty, so we'll just touch upon a couple of very basic things here. Overall, I would say there are a large number of differences that patients can desire with regard to their nose. Some of the more common ones, some people have a sort of a hump here in what's called the dorsal hump. That kind of makes the top of the nose kind of protrude forward, and a lot of patients like that to be reduced a little bit in size. In a large number of patients, they feel that the tip is like a little bit bulbous, kind of round or large appearing. I've had patients come and say, I feel like I have this ball at the end of my nose, and I would like that to be kind of refined. So tip refinement is another common procedure that we'll do as part of the rhinoplasty. Sometimes patients, they think they have a wide base of the nose, either here in the upper part of the nose or sort of the bottom. And in those patients, we'll do either sort of an alar cinching operation to kind of move the outer nostrils in together, or even break the bones up here in a sort of a maneuver called lateral osteotomy, to really kind of move those bones a little bit closer and then kind of make the nose a little bit thinner. There are many others as well. There's grafting, where you move some cartilage from part of the septum to parts of the nose. Correction of septal deviation, other things to do to improve the combination of function and appearance. Like I said, it's a very wide-ranging topic, and really to kind of focus, the best way is to go see your plastic surgeon and really get a consultation. They can really limit and focus the areas of discussion. For me personally, that's what I see mostly in my patients, sort of those combination of maneuvers that I mentioned. I'd say, best candidates for the procedure, patients for whom facial growth has finished. So basically, patients usually over the age of 16, but preferably 18. I have done, for example, some complex nasal reconstruction operations on patients at the age of 16, who have had, let's say, congenital deformities of the nose. And so 16 we use reconstructively as a cutoff because we know their facial skeleton has really kind of mostly finished developing. But for cosmetic patients, I like to wait till they're 18. In terms of procedure, most commonly I perform what's called an open rhinoplasty. It's a tiny incision made sort of at the bottom of the nose here, in between the nostrils, and the incision is brought up into the nostrils, so that part of the incision is well hidden. Then lift up and dissect off the skin and fat off of the underlying nasal skeleton, the sort of the cartilage and the bone which makes up the nasal framework. Once I have access to the cartilage and bone, then I do the maneuvers or the different things to really kind of reshape things. And once finished, then I kind of push the skin and fat back into place, suture things up, get things packed and splinted, and patient's done. In most rhinoplasty operations, patients are done in about 2.5 hours. I do generally prefer patients to be asleep for the whole thing, much more comfortable for them, and I think I can do a better job for that reason. I would say that after surgery, most patients are off their pain meds in a couple of days. Truth be told, most of my patients, pain is really not a big issue for rhinoplasty. The biggest issue more is just that they feel they have a lot of things on their face. They have a splint on after the operation. There are some stitches where the skin is closed. Sometimes I'll pack them with a little bit of nasal packing in their nostrils, and then we'll put a gauze underneath just to catch any fluid in the first couple of days. So they finish the operation feeling like they have a lot kind of there in front of their face, but pain is really not a major concern. I have patients come back usually within the first couple of days to take out any nasal packing, and then again at about a week in order to take off the splint, to remove any sutures. And by that time, a lot of their bruising and swelling is well on its way to being resolved. At about 2 weeks, I'll tell patients most swelling, bruising has gone away. Any bruising remaining can be covered with makeup. And really the swelling really improves up to about 6 weeks. And from 6 weeks up to about 6 months to a year, the nose actually continues to remodel. For whatever unknown reason, we do know from experience that the nose does continue to change, especially in that first year after surgery. So that's something that patients can look forward to, that things continue to improve in terms of their appearance. Overall, rhinoplasty it's a big subject and complex operation. It requires really kind of careful consultation with your plastic surgeon, good communication, so you really have a clear idea of what the goals are, and the discussion really can be tailored to the individual patient. I'd say for my patients, they're very happy with the results. The rhinoplasty operation with good communication really can get achieve a nice goal that's in common between patient and surgeon.